up, sir. Well, good afternoon. Good afternoon, everyone, and thank you for being here. Welcome to the VNA of Central Jersey Community Health Center right here in wonderful Asbury Park. Welcome, Governor Murphy, Congressman Pallone, Mayor Moore. I see you back there. Mayor Moore, great partner. Thank you for being here. Chairman Conaway, thank you for being here. Assemblyman Hoteling, thank you for your leadership and being a great representative here, along with your colleagues, Assemblywoman Downey and our great Senator Vin Gopal. Thanks for being here today. I know we have commissioners, several commissioners, the woman who needs no introduction. But I always wanted to say that, Commissioner. I always wanted to say that, Commissioner Persicelli, Edelman, Norbert, and Carride. Thank you all for being here. Caitlin O'Neill. Caitlin from the Harm Reduction Center and the Harm Reduction Coalition. Thank you for your ongoing leadership, you all being here today, and the critical support that you each provide to our mission of building healthy communities and enhancing well-being helps us to save the lives of those struggling with addiction and opioid use disorder. Your continued commitment allows us to lead them to treatment and ultimately, on the lifelong path to recovery. I would also like to recognize some distinct team members from the Visiting Nurses Association Central Jersey Community Health Center. Our leader on our board, our chair, Jenna Vaccaro. Thank you for your ongoing leadership and for all of your support. Dr. Steve Landers, VNA Health Group, President and CEO, whose tireless support, not just through the vaccination effort, but each and every day, makes the VNA family better and more purposeful in our communities. My partner, Dr. Terry Schlimbaum, our Chief Medical Officer. Dr. Christine McCoy, the chair of the Children Family Health Institute, who oversees the Prevention Resource Network and its harm reduction program, which hosts the first and only of its kind in New Jersey to date of a low-threshold buprenorphine program. Shannon Preston, for your hard work in leadership in the PRN program and the harm reduction program. Bobby Lowry, we all see your hard work each and every day. When clients walk through your door, they are on a road to recovery. When they walk through your door, you don't pass judgment, you don't ask questions, you get them to the treatment and to the services they need, they deserve, which simply saves lives. Bobby, amazing work. To our providers, Martha Oates, Michael Zito Govert, Michelle Torriello, amazing team of providers who stop at nothing to get the patients the care that they need. Really tremendous effort, and all through the pandemic, I might add. Kaylin McCallum, our program manager of our MAP program, Sam Purnett and Kim Costello, our practice managers who make everything here happen at the Community Health Center. No matter the challenge of the day, you all do amazing work that ensures our patients receive the critical and life-sustaining services we provide right here in this very building. Thank you all. And most importantly, and as the governor walked through and met a number of our team members that are on the front lines today, making sure people receive affordable, high-quality, open-access health care. Let's give a round to the incredible frontline healthcare workers working today and every day. Last and not least, an individual at the VNA Community Health Center who works just about every day in support of our mission, making sure that we do what we do and making sure that things get done and things happen in my office. Patty Scherer. Patty, thank you for your ongoing leadership. I also say, as I lead in, I also see somebody who is instrumental in breaking down barriers, not just in Asbury Park, but in New Jersey and around the nation. Christian Fuscarino, Garden State Equality. Thank you for being here, my friend. Breaking down barriers to affordable, high-quality health care is really the cornerstone. It's the hallmark of what we do in a federally qualified health center. It's the hallmark of what we do right here at the VNA Community Health Center. Today's bill signings not only underscores the governor's commitment and ongoing commitment to end the opioid epidemic, but also empowers those at the community level who know their communities best to improve access to a whole host of addiction services. We are especially grateful, Governor, for your ongoing support, your administration's support, and the legislators' support for all you're doing to empower patients on their journey to recovery. And without further, Governor, let's all give a warm welcome to the Governor of the great state of New Jersey, Phil Murphy. Governor, thank you. Thank you for being here.
I really appreciate it. Thank you, thank you. Thank you all. What a treat to be here. And thank you so much, Chris, to you and Jen and Steve, who I've seen. Steve and I go way back, but I've seen, as do you and I, and Tammy sends her best. We've seen a lot of each other over the past 16 months. And this is another day in the right direction. So thank you for your introduction to you and the great team. Again, Jen, Steve, but the great folks I met today and many I've met before from the Visiting Nurse Association of Central Jersey Community Health Centers. Thank you for opening your doors to us today so we could take the next big step forward in our fight against New Jersey's opioid use crisis. We had hoped to do this outside. Mother Nature not with us today, so we couldn't take that risk. Let's hear it one more time for the VNA. Thank you all. We're joined by my congressman, one of the great leaders in America, the chairman, Frank Pallone, is in the house. Frank, bless you. And whether he leads, whether it's expanded insurance coverage for opioid use disorders, other community-based supports, you name it. I saw your beautiful picture in the paper today with the speaker on transportation infrastructure, so many other areas. The legislators who are here, Chairman Herb Conaway. Herb, great to have you here, man. Dr. Herb Conaway, importantly. Great to have you. Eric Hoteling, God bless you and thank you for representing the Rocking 11th. And please give Vin and Joanne our best. And this is not an abstract day for you, I know. And God bless you and Linda and all that you've been through. For the folks, other legislators, there's Joanne. Joanne Downey's in the house. Nice to see you. I was back and forth this morning with Senator Joe Vitale, Assemblyman Anthony Varelli, Assemblyman John Armato, who has also suffered personally, and there have also been, among other legislators, I might add on both sides of the aisle, who have been great leaders in this fight. The members of the cabinet, Chris mentioned them, the woman who needs no introduction. I have withdrawal symptoms when I don't have a day when I'm not hanging with Judy Persicelli. Judy, great to have you. Banking and Insurance Commissioner Marlene Caride. Marlene, thank you for everything you're doing. The amount of folks we've signed up over the past now many months on our healthcare exchange is really impressive. Children and families, yeah. Marlene and I shamelessly fishing for applause. Children and Families Commissioner, the great leader Christine Norbert Beyer. Christine, great to have you with us. Acting Commissioner of the Department of Human Services, the great leader Sarah Edelman's in the house. Caitlin O'Neill, the aforementioned Caitlin O'Neill, the great mayor of Asbury Park, John Moore. Is Donna Vieira here? Donna, I didn't see you. Donna, you were here? City manager, I want to give her a shout out. I got Caitlin Caruso, Director of the Division of Consumer Affairs. Dr. Anthony Falzone, Chief Medical Examiner, representing the AG, NJ Cares Director Sharon Joyce, and a cast of thousands. Throughout the past 3 years, alongside these leaders and many others, we have worked tirelessly to erase the stigma associated with opioid use disorder and people who use drugs, to close gaps in treatment, and to expand access and use of life-saving medicines like naloxone, and to support the work of syringe exchange programs and harm reduction centers like the one we're at today. I have to give a shout out to my colleague Dante Colucci, who made the decision to put this event indoors. I just want Dante to know I saw a gentleman just walk by with an umbrella up, so that was the right call. And Christian Fuscarino, I love you, buddy. I meant to say you earlier, God bless you, and great to have you with us. We have backed up new laws with critical investments in our state budgets, but through it all, we remain centered on the fact that there is no one single magic wand that we have to end our opioid crisis. We could not let up, and we could not stop looking forward. Indeed, over the past 16 months, as we battled the COVID pandemic, we have never forgotten the need to continue our work against the overdose epidemic. COVID made this fight even tougher as we face strong headwinds of social isolation, job loss, grief for the death of loved ones to COVID, financial insecurity, housing insecurity, on and on. But we persevered. Through hard work and perhaps the grace of God, we did not see an appreciable year-to-year increase in opioid-related deaths from 2019 to 2020. But that is small, small, small solace. We still lost more than 3,000 members, blessed souls, from our New Jersey family to opioids in the year 2020. And I think importantly, somewhat alarmingly, we have to accept the fact that the number of lives that we have lost in the first 4 months that we have data, January, February, March, April of this year, is outpacing those lost in these months across each, not just of last year, but each of the past 4 years. And Judy, you and I haven't had the depth of conversation on causal effects. I personally think, at least partly, this is a fallout from the long slide of the second wave. It was bad enough to go through this the first time, and then to go through it again and have that long tail that we had to deal with until we got almost now 5 million people fully vaccinated. I think that's got to be at least part of it. So we must act now, and we must act decisively if we want to stem this tide across the rest of 2021 and beyond. To be clear, addiction is a chronic disease. Just like diabetes or hypertension, it is not a moral failing. The services provided at this center, Chris, by you and your colleagues, the very ones strengthened by this bill package, I have to say, are critical because every single life is worth saving. Fighting the COVID pandemic required a commitment to mitigating the virus's harm by slowing its spread, wearing masks, social distancing, testing, and ultimately vaccination. A few weeks back, Chris, you, Frank, Judy, and I came together not far from here to inaugurate a COVID vaccination program on the boardwalk. The fight against the opioid epidemic has similarly required a focus on harm reduction by providing safe and compassionate access points to care, like we see right here, and by securing funding for vital programs and recovery services. Yet in this fight, there is no vaccine. Our opioid crisis can only be stopped by continued compassion, vigilance, and hard work. So today I am honored to sign 6 new laws to further our efforts. And I think we can group the 6 laws, broadly speaking, into 3 categories. To further expand low-barrier access to naloxone and bridges to MAT, or medication-assisted treatment. Secondly, to strengthening our ability to collect and analyze key public health data. And thirdly, to build resiliency among children and families impacted by the opioid crisis. To that first point, expanding access to naloxone, we have a tremendous example in the efforts of the Department of Human Services, which in each of the past 2 years, right? Am I right, Jen? Has held successive events to freely distribute naloxone to anyone who requested it no questions asked. These events distributed more than 130,000 doses. We shouldn't wait for another special program. We should make this access year-round, period. On Tuesday, I signed our new state budget, which took effect yesterday. And that document, too, ensures continuing investment in an interdepartmental, data-driven, and compassionate approach to ending the opioid epidemic. It will support the work being done here, Chris, and at additional harm reduction centers statewide. I mentioned the interdepartmental piece. Sarah, Marlene, Judy, Christine are 4 examples of a broad whole-of-government approach to this. We do not leave any stone unturned, and we've got great legislative colleagues who work alongside. And importantly, the budget removes a critical rollback to essential services like food, clothing, shelter, and temporary rental and utility assistance for those with prior drug convictions and who are on their own journey to recovery. They need our support to achieve their goals. We cannot let a dispassionate, bureaucratic standard stand in the way of their ability to live a healthy life. One last note. 2 years ago, literally today, not far from here in Freehold, I signed the Jake Honig Compassionate Use Medical Cannabis Act into law. It was named for an incredible young guy who passed away from cancer, but whose final months were made more bearable and whose life regained quality because of access to medical cannabis. Jake's law was a landmark expansion of our medical cannabis program, which today serves more patients who can see more participating physicians and who can visit more dispensaries than ever before. When I took office, the number of New Jerseyans who participated in the medical cannabis program was 17,000. Today, more than 115,000 New Jerseyans have access to this life-saving treatment, a nearly 7-fold increase. I mention this because we know that increased access to medical cannabis means fewer people turning to dangerous and addictive opioids. Our continuing efforts to expand our medical cannabis program are a crucial part of our fight against the opioid epidemic. Please keep that little guy, Jake Honig, in your prayers. These bills today are landmark in their own right, but let's not mistake their place. This is not a monolithic package of legislation. Rather, these are 6 more foundation stones being laid alongside all of the other efforts we've undertaken over the past 3.5 years to meaningfully combat the opioid epidemic, which has held our state and indeed our nation in its grip for far too long. This is a crisis that is national in scope, as Frank knows well and he can attest to through his work with his colleagues. But we can and we must make New Jersey a model for others to follow. We are on the right path. We cannot at any cost step off of that path. We are continuing to build and shore up a strong foundation together with our administrative and legislative partners, and again, I thank them, and with Chris and his team here at the VNA of Central Jersey, countless other advocates, and the wonderful, caring, and committed staffs here and at other harm reduction centers across the state. This foundation, these stones in this foundation, is the solid base upon which residents can stand again on their own 2 feet, regain their lives, and do great things. And I am proud of all that we are doing together. I'm proud to sign these measures in a few minutes into law today. And I want to thank each and every one of you for being here with us today. Thank you to the staff in particular for welcoming me and all of us so graciously. It is now my pleasure to turn things over to a great champion for our communities who has helped lead this fight in Congress against opioid abuse and so much else, my congressman, the chairman, the one and only Monmouth County's Frank Pallone. Thanks, Frank.
I heard the governor say that New Jersey is a model, and that's really what I wanted to mention briefly today. And I see all the commissioners and the mayor and my assembly people here, and Herb is here too. The reason New Jersey is a model in this and also in the COVID-19 pandemic is very simple, and it's because the governor and Chris and others look at all of this practically. In other words, they're not ideologically driven. You know, we hear all this from Washington about the right or the left and, you know, who's on this side with the masks and everything. And that's the problem. In other words, this is the COVID is a public health crisis, and opiate addiction is a public health crisis. That's how they have to be treated, not whether you're a Democrat or Republican or right or left or whatever. I don't even know what the ideologies are these days. And that's really what's going on here today, which is, New Jersey has been out front not only in devoting the resources with the governor, but also expanding things like naloxone and bupe and making them available, and also making it possible, my understanding is these bills make it possible for expanded use by health professionals, paramedics and others. Because if you just limit it to doctors or a certain number of doctors, then you never actually address the public health crisis. And so that's really the model, Governor. That's why New Jersey is first and really a great example. And of course we saw it with the COVID pandemic as well, and all that you did. If people didn't want to wear masks, you said, well, you have to wear a mask. If people didn't want to get vaccinated, you said, well, please get vaccinated. How many times do you beg them to get vaccinated? Because we're looking at this from a practical point of view. And all I want to say, in terms of the federal level is I think you also said, Governor, that this has to be a united effort, right? It has to be at the federal level, at the state level, at the local level. Chris, this harm reduction center, which I understand is located in the same place where you have the HIV/AIDS program, again, an example of what you do practically to get people help and treatment and prevention. And this is the same thing. But that's what we're trying to do on the federal level as well, and I'll be very brief. Basically, at the federal level, what we've done is in each of the major bills, whether it was the CARES Act or it was the omnibus appropriation or it was the American Rescue Plan, getting out more money to the states and the towns and to the community health centers so they can address the opiate crisis and behavioral health issues in the same way that we were addressing the COVID crisis. And then the same with our committee in terms of trying to make it so more professionals can administer the medication. This is what has to be done. But all I can say is that New Jersey's in the forefront. And again, thank you, Governor, and the legislature for all you've done in that regard. Thanks again.
Thank you, Frank. I don't know what would do without you, and I've said this many times. No matter how good a job we do in the four walls of New Jersey, we need fighters, and there's no better fighter than you in Washington fighting for our interests. Two quick comments. If anyone's watching at home and wondering why we're wearing masks, have we changed our policy? We haven't. Judy will back me up on this, but we're in a healthcare setting. And that's one of we've said planes, trains, buses, any healthcare setting, long-term care facilities, any other vulnerable communities like a prison. And that's why we have masks on today. We have not changed our stripes on that. And please, God, I hope we don't have to, but we have to stay vigilant. Secondly, to your point, Frank, about Washington, left, right, and all that sort of stuff, in the National Governors Association meetings in Washington, at that point in the Trump White House, where there's a series of meetings that go most of the day, a lot of ideology used to run through where the administration was, where the Republican governors were, where the Democratic governors were. The one topic that united all of us with little to no ideology was the opioid crisis, to your point. This is not about what political party you're in, what economic strata you're in, what ethnic, whatever, how much your mom makes or whatever it is. We are all in this together, and we have to think of it that way. And I think that's, to your point, and I appreciate the good words, I think that's why New Jersey, God willing, we have got to bring these fatalities down. We are so far from the end zone on this, folks, but I think the path we're on is the right path. Please, God, that we're right about that. There are two legislators that we need to hear from, and they are representing a group of legislators who have been extraordinary in both chambers. They happen to be both from the General Assembly today, but again, I bring greetings at a minimum from Senator Joe Vitale, who wanted to be here but could not. First up, let's bring up the chairman and a medical doctor, a great leader on this and so much else, Assemblyman Dr. Herb Conaway.
Thanks so much, Governor. And I'm very Proud to be here at the signing of these important pieces of legislation. You mentioned these pieces of legislation run the gamut, but there's a commonality to them. First, leadership counts. We wouldn't be here today if it wasn't for an administration that had a forward lean on doing what it takes to bring health care to everybody who deserves it in this state. And that's, by the way, everybody deserves access to high-quality health care. And second, it's being driven by data. All of these bills have an underpinning of data behind them support moving forward. We know that if people have access to naloxone, we know that we're going to save lives. We know that if we help families and people who are in distress in families remain with kinship relations and other people who've cared for them, that their outcomes are better. We know that if we extend the reach of hospitals and give buprenorphine during emergency situations, that we can reduce the withdrawal that drives people to reuse. All of these things driven by data. That's the way government, in my view, on work. I hope over this, I've been over 20 years with this, and tried as we think about healthcare policy to always have it driven. And really all of our policies should be driven by what the data shows. And that's what we're doing here today. Very proud to be a part of it and to help as I can. We have great partners in the legislature on both sides of the aisle and in both houses. And just say congratulations and really thanks to all of you. It's been mentioned, but I'll say it again. Thanks for all of you who are in the front lines, treating people with compassion, having an open door policy, recognizing that I don't care what strata of society you're from, where you are, where you live, you're impacted by this. And if fortunately you're not, you need, as part of this human family, to feel compassion and to care for those who need care. These bills will help provide that, and I'm proud to be a part of it. And thank you, Governor, and the entire administration for all the work you've been doing to bring us here today. Good morning.
Herb, thank you. And Herb deserves another shout out, and Judy knows as well. Herb also oversees the health department for Burlington County and has been an indispensable partner throughout the COVID crisis over the past 16 months. So Herb, for all those reasons, God bless you and thank you. Representing the 11th District, we're in their backyard. Joanne Downey's in the house. Joanne, great to have you. I'm going to see Vin a little bit later this afternoon, Senator Vin Gopal, who's another great leader. And as I mentioned earlier, Eric and his great wife, Linda, this is not abstract to them. So please help me welcome Assemblyman and a dear friend, great leader, Eric Hotelling.
Thank you, everybody. It's very special to be here today. It's actually very special to be a New Jersey State Assembly member representing the 11th District, having great facilities like the VNA here for many reasons, because of all the things that they do. And, the opioid epidemic that we're signing 6 bills for today it's not just doesn't affect just the person that is addicted. There's a whole lot of people that are affected by that as well, and who care. And, always constantly wondering what could more they have done. I mean, it leaves a lot of answers, and there's a lot of victims from this as well in the state of New Jersey and all over this country that struggle just as much. And I know that from personal experience, I know with my son when he was in rehab, that was the greatest time for us as family members. And I'm sure when we had our conferences, when we had a lot of them, and all the other parents were sitting there as well saying the same thing. That's the only time they're free for a moment, because they know that their child is being taken care of or their loved one. These are troubling times we have, and the opioid epidemic, for me, is prescription-driven a lot. There's a lot of things that we still need to be looking at, but as a resident of the state of New Jersey, I am just very proud that this state stays focused on where we need to go and what we need to do. So we have a series of 6 bills here today. There's more to come, because we know we got a long road ahead of us, but through our leadership of our governor and the whole staff that we have, we're focused on this, and we're going to try to make a difference, and we are going to make a difference for those that are affected in many different ways, and making our state a better place to live, and I think that's always been our goal here. So thank you for everybody that's contributed with this, and Governor, thank you for again being here in the 11th District with us.
Eric, thank you. God bless you. Also, we are the quintessential organized labor state, and Eric lives that in his life every day. So we have one more speaker. She has no fans here. As you heard, Caitlin O'Neill has no supporters. True. But probably the most popular person in the state right now. God bless her, and she does extraordinary work representing the New Jersey Harm Reduction Coalition, the one, the only, the singular, Caitlin O'Neill.
There goes my earring. Okay. I have some notes. So hi, everyone. My name is Caitlin O'Neill, as you heard, and I'm the Director of Harm Reduction Services at New Jersey Harm Reduction Coalition. It's definitely a widely known fact that harm reduction works, as you heard today, and it's been proven through decades of evidence and research. I don't need that research, though, because I know that harm reduction works by the fact that I'm standing in front of you today, just a few days shy of the 10-year anniversary of the day I made the decision to stop injecting drugs. Thank you. Thanks. And I just want to say that actually says less about me and more about compassionate harm reduction services in the state. My participation in the syringe access program at NJCRI in Newark provided me with stigma-free support, sterile supplies, and planted the notion in me that my life had value. After a few years of making small positive change, I was ready to make a really big one, and that was to stop my injection drug use and enter recovery. We have entirely too much evidence of what happens when people don't have access to harm reduction services. And many of those people are no longer here with us to share their stories. And that includes who I'm here for today, my partner Joseph, who died from an opioid overdose in 2014. My organization and the 7 harm reduction centers that we talked about earlier, many of whom are here today, our harm reduction family of New Jersey provide consistent low barrier naloxone access to our communities. There's never a cost, trainings are short and sweet and welcoming, and there's no limit to how much naloxone people can have and take home with them. Because to make a dent in the overdose crisis in New Jersey, we need to make it possible for every single person who's likely to witness or experience an opioid overdose to have access to naloxone, especially people who use drugs, people who used to use drugs or are in recovery, our friends, family members, and neighbors. This bill allows that to actually become a reality in New Jersey so that cost, location, and stigma will never stand in the way of keeping one another alive. I'll just wrap up with a quick story about one of our New Jersey Harm Reduction Coalition community naloxone distributors. She's a person who uses drugs and currently sleeps outside, and a mother who lost a child last year to street violence. Despite all of this trauma, she chooses to distribute naloxone to her community members who are at risk of overdose. And last year, during the global pandemic, she single-handedly reversed 15 overdoses in her neighborhood. She is our proof that widespread community naloxone access, which is made possible by these bills and today's bill sponsors and Governor Murphy, that these bills will truly save lives. So Governor Murphy, Assemblyman Conaway, and Senator Vitale, Assemblywoman Huddle, and all of today's bill sponsors, I'm here today to commend you for this life-saving legislation and to thank you for hearing our calls to action when we told you that we need widespread community naloxone access in order to survive the overdose crisis. I look forward to continuing this fight to ensure that from the mountains of High Point to the boardwalks of Atlantic City, every corner of the Garden State will have access to a full spectrum of life-saving harm reduction services. Thank you.
Caitlin, God bless you. Let's hear it one more time. Caitlin O'Neill. I'm going to demask for 1 second. I'm going to hand you this. Don't ever say I didn't give you anything, Dante. 2 things that are not related to why we're here today. I wish everybody a fabulous 4th of July weekend. Have fun, enjoy yourself, please do it responsibly. Please, please be responsible, folks. And secondly, on behalf of Judy and all the medical experts here, get vaccinated. We have, for the past 15 days, we've been bouncing a little higher, a little lower than 300 people in the hospital. I'll bet you anybody, I'll bet with anybody, all of them are unvaccinated. All of them are unvaccinated. Folks in the IC unit are unvaccinated. Sadly, when our hospitals report deaths, as they did a few overnight, they are unvaccinated. This is a pandemic of unvaccinated persons. And while we have the best vaccination program, and Judy and her team deserve enormous credit, of any state in America, we're bordering on 5 million New Jerseyans fully vaccinated, which is extraordinary. We are not letting up. We have people, as we speak today, knocking on doors, I think, in 22 communities in this state, going literally door to door. Have you been vaccinated? Why not? Multiple languages, by the way. Here's the location nearest you. Do you need a ride? Whatever we could do to get folks vaccinated. Those are my two pleas. Have a great 4th of July. Please get vaccinated. Let's sign these suckers into law. This may take me a minute or two because I want to try to associate the pen with the sponsor if there's any chance of doing that. This is an extraordinary list of folks who are going to get these, and probably many more deserve them. First of all, I can't see a thing, but this will be the money shot. Everyone will say, oh, look at him signing the bill. And we all know that he wasn't signing the bill. Okay, again, we've got 6 of these. And they're all incredibly important. And I'm going to read, if I may, the sponsors and the synopsis for each one of them. It may take an extra minute or two, but it's worth it. This is Senate Bill number 3491. Sponsors Joe Vitale, Joe Lagana, Assemblywoman Valerie Veneri Huddle, Assemblyman Anthony Borelli, and Assemblyman Dan Benson. And the synopsis is, it revises and expands authorization, good, Dante, thanks. Authorization for any person or entity to obtain, distribute, and administer opioid antidotes. And again, Caitlin made the case for that as powerfully as I've heard. So, here we go. Everybody good so far? July 2nd? Yes. Okay, just checking. First pen, Chris Rinn. Thank you, buddy. Second pen, to my congressman, Chairman Frank Pallone. These are official Phil Murphy pens, by the way. This one I'm going to bounce down, and Dante, I'm going to ask you to give this in absentia to Senator Joe Vitale. This bill is now the law of the land. Second bill, Senate Bill number 3803, sponsors again Joe Vitale, Holly Schapisi, by the way, as we've mentioned, both sides of the aisle leading here, Herb Conaway, Dr. Herb Conaway, Chairman, Valerie Veneri Huddle, Anthony Borelli. And the synopsis here permits certain paramedics to administer, I always mess the, buprenorphine? Buprenorphine. Yeah, buprenorphine, I got it, broadly speaking, I got that right, Herb. So, well done, everybody. This bill, again, to the aforementioned Chairman and Dr. Herb Conaway. Herb? Thank you. This is more complicated than you might think. Dante, we're going to ask you to hold this one for Assemblyman in absentia, Anthony Borelli. Anthony? This one is for Caitlin O'Neill. Thank you. There you go. Thank you. And this one is now the law of the land. This is Senate Bill number 3814. Sponsors Senator Fred Madden, Assemblyman Herb Conaway, Assemblywoman Gabriela Mosquera, and Assemblyman Chris Tully. This requires DCF or court to consider placement of children with relatives or kinship guardians when making placement decisions. And it makes changes to certain standards for initiating petitions to terminate parental rights. And Christine Norbert Beyer is with us. And Christine, this is one I know that's near and dear to you for good reason, to do everything we can at every turn to get kids with people who they're related to, who they know in some form or fashion. That is a potential game changer for them. And so with that, please acknowledge we're giving this pen to Commissioner Christine Norbert Beyer. How about a pen to the woman who needs no introduction? The Commissioner of the Department of Health, Judy Positano. Yeah, this is very complicated up here, trust me. How about one for Commissioner of the Department of Banking and Insurance, Marlene Caride? This is now the law of the land. We now go to Assembly Bill number 5595. Sponsors Anthony Varelli, Dan Benson, Jamel Holly, and in the Senate, Vin Gopal and Joe Lagana. This requires the Division of Consumer Affairs to publish retail price of certain opioid antidotes. And frankly, the more transparency there is around pricing, the more competitive, that pricing is, and the better a deal the folks who need it the most have. And that's incredibly important. So I will. That was an express signing. Joanne Downey, Assemblywoman. This is now the law of the land. Great to see you. Okay. We're almost there. Okay. This is Assembly Bill number 5597, sponsored by Herb Conaway, Angelica Jimenez, Shanique Spate, Senator Joe Vitale, Senator Shirley Turner. It permits school districts to administer student health surveys after prior written notification to parents and legal guardians. I want to make a point about this one. This used to be an opt-in survey basis. It is now an opt-out survey. So the parent will have to volitionally say, I don't want either I or my kid answering the survey. When it's an opt-in, unfortunately, you get a very low take-up rate. And the good news is this will increase the take-up rate in a big way. How about Commissioner, Acting Commissioner Sarah Edelman, right in front of me. Congratulations. We're going to give this one to your Associate Senator Vin Gopal, Dante. This is now the law of the land. And last but not least, and again, apologies for this, it's taking a little longer, Assembly Bill number 5703, sponsored by John Armato, Anthony Varelli, Herb Conaway, Senator Don Adiego, and Senator Joe Lagana. It requires certain health insurers, Medicaid, NJ Family Care, SHBP, and SEHBP, to cover opioid antidote without imposing prior authorization requirements. Again, Caitlin, this is another example of breaking the barrier down and getting this to the point of attack as efficiently and as affordably as possible. So, one of the sponsors is a guy, again, who suffered in his own family, and I want to give this one and acknowledge in absentia Assemblyman John Armato from the 2nd Legislative District. And the last one goes to a dear friend, the guy who spoke so eloquently, who knows this all too personally, a great leader, Assemblyman Eric Hotelin. So this is a great moment, and God willing, these are steps that when we look back years from now, we'll say, you know what, these were game changers. I want to thank all the sponsors, both here, legislators, all the advocates, members of our administration, healthcare workers, folks like Caitlin who are on the front lines, who have both lived it and are treating others who are living it as we speak. On behalf of all of them, and in memory of the lives lost, and God willing, in honor of the lives that we will collectively save, God bless you all. These are all now the law of the land in New Jersey. Happy 4th of July, everybody. God bless you all.